Thank you. I apologize for being late. Let's all rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Mr. Pratt, will you certify the agenda, please?
Yes, Mr. President. Chris Pratt with the County Attorney's Office. Our office has reviewed all of the items on your agenda this evening, and they have been reviewed and meet legal approval.
Okay, thank you. Do we have any member disclosures for this meeting?
I have none, thank you.
I have none.
Thank you.
I have none. I have none.
No, sir, I have none.
Okay, and I have none either. We have the meeting minutes from our last regular meeting in March, and we need to approve those, I presume. So I would take. Has everybody had a chance to review the minutes, and are they acceptable?
Yes.
Okay. Do I have a motion to move the meeting minutes?
I will give you a motion to move the meeting minutes.
Thank you.
Second.
I have a motion and I have a second. All in favor, say aye.
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 Thank you. Now we'll move on to the regular agenda. Executive Director Hill, I will turn it over to you.
Okay. As soon as I can figure out how to work the microphone, we'll be good to go here. All right, so I'm just, again, going to synopsize this report that I've provided to you in writing. Still a lot of meetings trying to get this organization put together and off the ground. I have had the chance to go and meet with Tri-County in person and learn more about their programs and getting a pretty good working relationship with staff up there so that they're helping us through our transition. I've met with the environmental health people at the state, CDPHE, and with the WIC people at CDPHE and had very productive conversations. So again, they're also working to help us do a good job of bringing this all together. We're ready to go on June 1st with Vital Records. We toured the space where Tri-County was providing that service down here on South Wilcox this afternoon. Everything looks good. IT has it just about wired up and ready to go for us to use that space. They're turning over the access to it. We have the codes for the burglar alarms, and our key cards are going to work. So we'll be in there doing Vital Records by June. We have a candidate selected for the finance and grant manager position, who I think has made it through all the HR steps and will be coming on the first part of May. I'll be interviewing in the next few days for public health records clerks that are going to do the vital statistics, and for a vital administrative assistant to help me keep things straight. I'm also going to make sure that my administrative assistant is trained on the vital records process so that he or she can be a backup to the records clerk, so we don't have a shutdown period when people can't get birth and death records. And I did, take a formal action to notify the state that we're taking over that service June 1st. We did also initiate an RFP that was posted today for the service provider for the community. I'm calling it a community health division rather than trying to say clinical nutrition and community health promotion. So all of those functions we issued an RFP for. Other than there's a new wrinkle there, my conversations with the WIC program, I think we can do that in-house, and I think they'll give me enough money to do it in-house, so I'm going to pursue that program in that way. Future plans, keep working with Tri-County. I'm going to be moving into the Suite 103 of the 410 South Wilcox building on Tuesday. I'm going to be working on firming up the medical officer. Right now we got Dr. Smith on an interim basis, but I want to do a public process where everybody who's interested can put their interest in, including Dr. Smith, and get a permanent medical officer in place. Let's see. Pretty much that's it. At the reminder for our work session next week, I'm working on a spreadsheet for you where I'm going to provide all the services that Tri-County does now, whether they're required or not, their priority ranking if they were ranked in the community outreach, my recommendation on whether we should do it or not, whether there's money attached to it, are we making money, losing money, and then other comments. So I'm bringing that to the meeting, and I'll try and get it to you a few days ahead so you can look at it. I want to have your input on all of these services. You don't have to agree with my recommendations, but I want to come away understanding your thought processes so that in the May Board of Health meeting, I can bring some formal recommendations to you on the services that the health department should do, which will then help me figure out a clearer path in bringing the health department up out of the ground.
Thank you. Are there any questions from board members? Talk about vital records. Real quick. That's my understanding. That's run by. We're basically just taking over the contract. Is that how it works? That Tri-County has. How does that vital records process work? Because when we were looking at that on the advisory committee, it appeared to be one of the easier things to sort of offload from Tri-County to us.
And what you said is the reason it's the first one we're going to offload from Tri-County
Right.
onto ourselves. But the way it is, the state issues all the birth and death records technically through their computer system, but they expect all the local health departments to have an office where people can come in and get birth and death records. We can issue a birth record for Mesa County or any county in the state of Colorado, but it's just a convenience thing for our people. So if you need a birth certificate to get your kid into school or into camp or to get a passport, you can come down to our office Monday through Friday, 8 to 5 after June 1st, and get your birth certificate right there. Or if you need a death certificate, or you can come and get them right there.
You say for only Douglas County or for any county in the?
We can issue them for any county in Colorado.
Okay. Yeah, no, that appeared to be an easy one.
There's a lot to actually doing it and a lot of requirements, but
Right.
the idea of taking it away from Tri-County it's the easiest one to do.
Right. Are we still on track for a clean handoff by December 31st at the end of the year?
We are. We're also working on a contingency plan in case things start to go south for Tri-County sooner than that we'll be ready to step in and be a safety net so the community doesn't go without some of these services.
Okay. I'm tempted to ask a whole host of other questions about that last statement, but maybe I won't.
Tempted not to want to say
You
things that
said
I've
quite a
learned in
bit already.
confidence. Yeah.
All right, so I have no other questions. Does anybody else? Okay. Director Hill, I believe we're also going to talk about, the next action item is an action item, approving a staffing plan.
Yeah, so I'm merrily going on my way trying to hire people, but in fact, there is no budget in the county to put these people into. So I'm trying to get a staffing plan approved by your board first and then by the commissioners that authorizes the budget department to put some money in there to actually pay the people I'm hiring. So that's what tonight is about. So I've provided an organizational chart. The top part of it is pretty firm. The lower you go, the more tentative it is, because until you tell me whether I'm going to do certain services, I don't know whether I need a staff person to do that. But I know I'll need the leaders of all these divisions because there'll be some function in every one of those divisions. I know you need some of the staff, like the people who are going to do the vital records June 1st, I got to hire them. The people who are doing and will be doing preparedness and disease response starting in July, I got to have those people hired and in place. So I'm looking for, approval on the open recruitments and the early recruitments right now, and approval in principle for the future recruitments to be further refined once we have our work session in the May meeting and we know what services we'll be providing. So I'm happy to answer questions on any of this stuff. Again, I don't like to sit here and read things to people who are educated and can read it better than I can.
Doctor, do you have any?
No, fine.
Okay. So the work session that we're going to have next week will fill in for you some of the details about how to move forward. Is that correct?
Correct. So most of this staffing plan is going to happen regardless. It's just where, lower down where I've got some like question marks.
Right.
Well, I can erase those question marks and know whether I need 1 or 2 health educators or if I need 5 health educators.
Right.
Once I first know what the services are, and then the result of this RFP that we posted for the other services, because if nobody wants to provide those and you tell me we need to provide them, then I'm going to have to staff up to do it.
Right. And much of this will be funded, I assume, working with the state with respect to funding is going smoothly in terms of, the state fiscal year starts July 1st, I believe.
That is correct.
So, and then the federal fiscal year is October 1st, so is a lot of your staffing pivoting off of those 2 dates?
Yeah, so like the WIC is a federally funded program, so that would start October 1st,
Okay.
assuming they give me the program, which I think they will. The preparedness is July 1st. It's federal money, but it runs through the state, so it's
Right.
coming to state. We're having a lot of happy times with people. They're going to give us money, but they haven't given any firm numbers. So we're getting money. We don't know how much. That's a little bit nervous-making for me, but I'm pretty confident we'll get enough to get the job done.
Okay. Okay, so what you're seeking from us then is a vote and approval of your tentative staffing plan.
Correct.
Okay. Has everybody had the chance to look at it? Okay. Why don't we pause here then and see if there's any public comment, because it's been posted publicly as well. And so let's take public comment. First, I'd ask if there's anybody in the room that had any comment on the staffing plan. Troy, is there anybody online that has signed up for public comment with respect to the staffing plan?
I have no public comment at this time.
Okay. In which case, I would see if there's any discussion on the board on the staffing plan. No? Oh, Doctor.
I'll just say one thing here, and we have hired Mr. Hill here to run this department, and I see no reason at this point not to give him our full support.
I will just note she said at this time, so.
I'm not an attorney.
Commissioner Teal, did you have a comment?
Yeah, going through it, I've had a chance to review the staffing plan he's put forward, as well as the org chart that we've gotten from Mike. This looks pretty boilerplate. It looks like Mike is applying his years of experience in similar positions, and there's nothing, I'm not seeing anything out of left field on this, and completely understand his comments in terms of establishing where the priorities of this board should be, in order to continue on. So I think this is a great start. I'm in favor of approval.
Great. Thank you, Commissioner. Well, in which case, if there's no further discussion, I would seek a motion in a second on approval of the staffing plan.
Okay, I will move to approve this.
Second?
I'll second.
Thank you. We have a motion, we have a second. All in favor of approving the staffing plan, aye, signify by saying aye.
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 Opposed? Great, thank you. The Next item that we have from Mr. Pratt is a litigation update. And this is a non-executive session update? Okay.
Well, actually, Mr. President, we would like, although there may be an action item we may ask for out of executive session, we would like to give you an update with and answer your legal questions in an executive session first.
Okay.
And in that, I would like to ask that pursuant to Title 24, 64024B, we retired, if you vote to do so, we retire to an executive session so that you may confer with an attorney to obtain legal advice.
Okay. What I would do then is, I'll move that we go into executive session. I'll seek a second and then a vote. So there's a motion on the table to go into executive session to discuss legal matters. Do I have a second for that?
I'll second that.
All in favor of going into executive session, say aye.
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 Opposed?
Aye.
Thank you. We will go into executive session. Just roughly, how long do you think this will take, just so people who are waiting know?
I'm guessing no more than 20 or 30 minutes
Okay,
at the most.
so we'll go about a half an hour, we think. Okay, so for folks who are waiting to give public comment or whatnot, we'll be back at that time. I just want to give people some idea.
It may be less, but
Right. Thank you. We'll go into executive session. We'll be back momentarily. Oh, yes. If you'll just give me a high sign when we're ready to go. Oh, we're good to go? Okay. Well, we are back from executive session. I believe, Mr. Ingalls, you are going to...
Good evening,
you're
this is
gonna-
Troy, your host. Are you ready to begin again?
Oh, we are. Oh, there we go. Okay. We are back.
now we're good.
Okay, we are now back. Mr. Ingalls, you were going to provide the public briefing that we need on the matters that we discussed in executive session, where we discussed the matters but made no decisions, and we're back down here to make
Yes,
take
Mr.
action.
President. First thing I'd like to do is just certify that we did in fact have an executive session for legal advice with the county attorney and Mr. Pratt, assistant county attorney. We talked about 3 pending court cases, 2 of which might require or at least suggest for at least further discussion down here. One is an open records case, and Mr. Pratt will give an update of where we're at with that particular case. And then a second case is the boutique and school litigation out of Castle Pines. There's a decision to be made with respect to an appeal. What would you prefer we start with?
Let's start with the non-action item, so that would be the Cora matter, and then let's move to the action item. And then, once we hear both of those, we'll move to public comment, and then we'll have board discussion, and then we'll vote. We'll vote on the matter that needs to be voted on, which I understand there's only one action item. Mr. Pratt, I will turn to you.
Thank you, Mr. President. As you may recall, at the last meeting, before the meeting began, we were served documents that indicated we had been sued over a open records request that the filer felt had not been filled. We have since discussed the matter with our attorney. We have filed an answer and response brief to the court. The crux of the case is for a particular document that had been marked attorney-client privileged and had not been provided in a batch of other documents that had been to the requester. Upon conference with outside counsel, we determined that there was nothing privileged or protected in that particular email chain, despite the label that had been put on it. And that document was provided to Mr. Marshall subsequent to that determination and prior to the filing of the case. We're not quite sure what happened. We had no further communications from Mr. Marshall until the service of summons for the hearing or for the case. We have since, in our answer, provided the document again as part of our filings, and we don't anticipate that that case in its current form is going to go forward anywhere.
Great. Thank you. Thank you. Are there any questions from board members on this matter? Commissioner Thomas?
And I have none. I appreciate that you've been thoroughly providing these open records requests that have been provided. So thank you for doing that and continuing to do that.
Commissioner Teal, do you have any questions or comments?
No, I appreciate the brief by legal counsel, but no questions.
Thank you. Any of my other colleagues?
No, no questions.
Great, thank you. Mr. Ingles, we will go back to you. Now, that matter was just an update. There's no action on that. We'll now move to the action item. Mr. Ingles.
Thank you, Mr. President. So the litigation out of Castle Pines, which I'll call the boutique and school litigation just for simplicity, we are at a point where we need to decide what we want to do. A preliminary injunction has been issued in that case by Judge Holmes. A preliminary injunction is an appealable matter. And based on discussions between myself and you, Mr. President, I filed a notice of appeal, but I did so as a placeholder pending a conversation with this full board. I did that knowing that we would need to discuss whether or not to do the full appeal or not. Filing the notice of appeal does not bind us, but I do need some direction on that issue. We did receive a settlement offer. I'm not going to discuss the terms of that settlement offer here because by its nature it is confidential, and I would ask the board not to discuss those specific terms either. But I do need to know if the board wants to pursue the appeal in that case. The gist of that appeal, as I understand it, would be that Judge Holmes determined that this board did not have the authority to issue the countywide public health order. He cited the IGA between us and Tri-County Health for that finding, and I believe that that particular finding is directly contrary to that IGA. So that would be my position. I await direction, and I certainly invite any discussion the board wants to have.
Thank you. And as I would, just for clarification, so we filed a notice to appeal, and we had discussed that. We did that because there were timing issues that we needed. Is that correct?
It wasn't time sensitive yet, but it was an important thing to do as a placeholder till we
Right.
had this discussion.
Right. Okay. Thank you. I would ask my colleagues if they have any comments or questions. Commissioner Teal.
I appreciated the information that we were provided in the executive session. And based on what we were explained by you and Mr. Pratt, I certainly would support continuing in the appeal that you've already started. Thank you.
And I also understand you're going to invite public comment. But
Yes.
Do you have any questions for me before you do that?
Commissioner Teal, do you have any questions or comments?
I have no questions for counsel. I have no comments at this time, but after we do hear from the public, I would like an opportunity to make comment.
Perfect. Thank you, Commissioner. So with that, I will ask if there are any comments in the room. Anybody that would like to comment in the room? Okay, Troy, do we have any comments online?
Thank you, Mr. President. I have no online comments.
Okay, perfect. Thank you. So with that, I believe then I will seek a motion in a second to approve, to authorize the county attorney's office to move forward with the appeal in the boutique case and moving forward with that. Do I have a motion to move forward with the appeal in that matter?
So moved, and Mr. President wishes to speak in favor of the motion.
Okay.
I'll
Yes.
second.
And Commissioner Teal, I believe you had some comments. So we have a motion, we have a second. Now I'll ask if my colleagues have any additional comments. Commissioner Teal, I believe you did.
Yeah, thank you, Mr. President. Appreciate that. I am in favor of moving forward with the appeal. I think it's, it's actually, there's a part of me that is actually very interested in hearing how the appeal will be heard by the appeals court. If a tenet of our society, the way America works, is that legislative bodies like our own make a decision and based upon an open process that I really think we had when we issued this public health order. As a matter of fact, if I'm recalling it correctly, it really took from the introduction to the idea until adoption a full month. So it was not a hasty, it was not a ill-informed decision to move forward with this order. Well, in the tradition of American governance, the legislative body has made a decision and issued a legislative directive. It is then incumbent upon the courts to determine whether that's appropriate, constitutional, violates current law, etc. So I think we should move forward with the appeal. I encourage my fellow board members to vote in favor of this motion. And yeah, let us see how the court does decide. If it is a matter that the court feels that it's an illegitimate order, great, let's get that on the record. If it's a matter of the legitimacy of this board, of the public health operations in Douglas County, well, so be it. We are moving forward as a county with my colleagues here on the Board of Health, as well as my colleagues on the Board of County Commissioners, to establish our own public health department here in the county. And even if there is a hiccup with that, if there is a determination, well, that's okay. That is adverse to this order. That's okay. That's a part of the process. We can make adjustments as we move forward, but Colorado law is very clear. This body is allowed to exist. This body shall issue legitimate orders as needed. I feel it's part of the process, and I fully am in favor of going to an appeal, and I speak in favor of the motion.
Thank you, Commissioner. Any other comments from my colleagues before I call for a vote? Okay, we have a motion, we have a second. All in favor of moving forward with the appeal, say aye.
Aye.
Aye. Any opposed? County Attorney, you are so empowered to move forward.
Thank you.
So now we are down to citizen comments. Are there any comments in the room? Okay. Troy, do we have any comments online?
I have no online comments.
Fantastic, thank you. With that, then, we've come to the end of our agenda. I would seek a motion to adjourn, a motion and a second to adjourn.
I'll move that we adjourn this Public Health, Board of Health meeting.
I'll second.
There was a motion, there's a second. All in favor of adjournment, say aye.
Aye.
Opposed? Thank you. We'll see you all in May.
Nice job. Thank you, Doug.
Yes, thank you.